to Wellbe Live. Today I have Fernando Moreno, who is a physical therapist, and he'll be talking to us about all things movement,
manual,
alignment.
Exactly.
So introduce yourself.
Fernando Moreno Jr. I'm a physical therapist of 6 years experience. I am a certified in Mulligan technique. I could talk later more about that. Certified in SFMA, which is a functional movement assessment. That's a great tool. And this weekend I just had a great course here in the city on rock tape. If you've seen athletes with the kinesio tape and stuff like that, all the cool colors.
Yes.
Well, I found out the science behind it and how to use it. It's another great tool to use. And always learning, always looking to see what to learn and how to use that and benefit, to help people. I've worked all these 6 years in orthopedic physical therapy, so sports injuries, etc., post-op. What got me into physical therapy? I'll get into that. I used to be in sales, also talking to people. I've always been a people person, right? Which helps a lot. Especially the first time meeting each other. I think it's important to get somebody comfortable. Right? I got into sales because of my dad. I got to travel, meet people. It was great. But at a certain point, I didn't see myself in that field. So I started looking into things in sports medicine. And
so was that just a general interest?
A general interest. I liked sports. I played sports, right? High school, college, and I knew I was good with my hands. Using my hands, using my people skills. So I volunteered at a local here in the city, physical therapy office, just to take a peek. I was like, I could do that. I could see myself doing that, right?
Yeah.
So I started going to school. I think September 11th was a big thing here, of course, in New York, and that, I'm sure, changed a lot of people's, like, what am I doing with my life? That sparked it. I said, I need to do something. So I went to Kingsborough Community College, taking all my anatomy courses. I loved it.
It's in Brooklyn.
It's in Brooklyn, yeah. Had a great time there, and it's funny, when you pick something that you want to do, a lot of doors open. Just from the first time I started taking anatomy, and everything seemed right, and everything was pretty smooth sailing. A lot of work, a lot of time, into school, married, had a kid, everything was a lot of things involved. But when you're passionate about something, it feels nice to accomplish it, right? So and then I went to Mercy College in Westchester. It's a great weekend program, one of the very few around the area. That's a doctorate program, physical therapy. Great teachers. What I liked about Mercy College is that the majority of the teachers are practicing therapists. So they bring fresh examples of what's going on in the field of physical therapy. So it was a very nice experience. From there, I started working in Midtown.
Oh wait, before you go to that,
yeah.
You mentioned Mulligan. So was that the technique that you learned at Mercy?
No, actually, that was afterwards.
Oh, okay.
So afterwards, when you come out of school, you can veer off and take certain techniques.
Oh, okay.
A lot of great physios, they call him. He's from New Zealand, Brian Mulligan.
Oh, okay. And so there's a base type that you learned, and then you can build on.
Exactly. I mean, anybody who's looking into physical therapy, it's great because you could veer off into different aspects of physical therapy, cardio, rehab, pulmonary rehab. So yes. So he was one of the gurus in physical therapy that came up with this technique, and got certified like 2 years ago. You do certain courses and you go for an exam. And it was a lot of fun. It was a great learning experience.
So what is the difference with that?
It's a different aspect, different approach. Physical therapists, we're experts in joints and how you move. The mechanics of the joints is very important. Not just only soft tissue, etc. So he's just another way of helping people move. Of how we manipulate joints and help you move. Just another technique. Safe technique, pain-free. So yeah, that's just a different aspect. There's McKenzie, there's other theories and and techniques that are out there. Yeah. So it was a great experience.
So do you find that it's like this back and forth between learning and then doing it, like applying it, and then
Always.
kind of like course correcting?
It is. Once you think you're not doing the right thing, but a certain idea, and a new idea comes out.
Yeah.
That's what's great. I try to surround myself with other therapists that we're always all learning.
Yeah.
And we challenge each other. So that's, I think that's a great, if you're going into physical therapy, I think you have to be able to admit that you don't know everything.
Yeah,
you're
well,
wrong.
I think that's with right?
Right?
A lot of these modalities,
Right.
especially what you're doing, because there's always new science, and then it can change. Yeah, and then or they learn something new, and then the practitioners, they want to like up their game, so to say, right?
Yes.
There's always going to be more information, and then it's like, how can you incorporate it? And it's almost, you can only be as good as the things that are out there. So the more things that come out.
I've always said that you could in anything you just could be a 9-to-5er and just punch in, punch out, and just do your job and walk out. I've always wanted to strive in anything I did.
Yeah.
I moved furniture. I did everything. Anything. My dad taught me that whatever you do, learn how to do it well.
Yeah. Show up.
Exactly. Show up.
But you also chose a modality and a profession, like you said, that you're passionate and you have a genuine interest in. So it's almost like when you hear that there were these new things, like I don't know, like I think in one of these interviews we mentioned the cupping at the Olympics. Like all of a sudden, like there'll be like these things, like you mentioned with the tape. Like, all of it, like you'll see that more, and so it comes up on your radar, and you're just like, oh, I want to learn more about that.
Exactly.
So like it never even dawned on me that there's like a scientific thing behind, like the tape.
Yes, there's reasoning behind it, why it works, why cupping works, whatever, and you have to be ready. We were talking before this about technology. You have to be ready because everyone will look it up.
Yeah.
Come to you, it's like, what is this? And sometimes you're like, you know what? That's interesting. I don't know. Look why. So it makes you learn more and look into why things work.
Yeah, and the techniques that were used before cupping, that they were still effective. Exactly. But then there's more and more things added in. Yeah. So then it's like you have a bigger toolbox to choose from in terms of the individual that you're working with.
Exactly. Well, you always have a lot of tools to work with. Sometimes you might use a certain technique that's not going to work, so you have to learn how to step back, right, and see, okay, what's not working. You know what I mean? So that's why I like it. It's always a challenge. I tell people you're not a car. You're just going to change a tire and that's it. But because everyone, we all move differently.
Yeah.
We all experience things differently. There are a lot of external factors that affect why we're in pain or why we're moving a certain way. So I think that's important to know.
So you said that you step back. Like I'm thinking of the like how do you do that with the client? Is it like, do you ask them questions so that they could share more of their experience? How do you start?
Right. So when you come in initial evaluation, you come in as much information. You learn along the way to get a lot of subjective information of why you're in pain, why you got there. A lot of that will give you a lot of information. I think when you first come out as a therapist, you just want to work on people right away because you're excited, you just graduate or whatever. But you learn that the person is going to give you a lot more information, and you have to be really good at weeding out certain information. A lot of people they're going to give you a lot. Right?
Yeah.
So you learn to like, okay, no, let's step back. When did it start hurting? So you learn how to weed out information that's going to help you. But if it doesn't, then you go through your assessment process, etc. I tell people, listen, we might know what you're here, why is it hurting, but we'll learn along the way.
Yeah.
We might know why your shoulder's hurting now, but along the way, we're gonna know your body more, how you're moving, because your stiff ankle could be your shoulder problem, etc.
Yeah.
So you have to learn how to step back. What's not working? Yes, you ask them every time, what's hurting, why is it hurting, what's helping, what's not helping, and then it's a learning process for both. For both.
Yeah, because I think for some people, I think it's great when they can articulate that they have pain in a certain area or that there's something. It's similar like with health counseling when someone has a distinct health goal. But it's not just about that one thing. Like the more you explore with each other, you find out that it could be like other things that lead to that concern. So like sometimes somebody will have like a shoulder pain, but it doesn't necessarily mean that it's stemming from that part of their body. So you want to be open enough to like see that there's other things that could be.
Right. There's this whole thing now that you're not chasing pain.
Yeah.
Right. Like I said, when you first come out, you want to just fix someone's shoulder right away. You know, decrease pain, etc. But why is it happening? Yeah. So. And
so understanding that why, or maybe like the source, or the core issues that are going on with the person. Do you find that happens over time? Like how long could that process be, or how short could that process be?
Right, it could be as short as educating them right, you know, during that session. Educating them about the pain process, how your body perceives pain, how it works. And then they're like, oh, okay, you know, I'm not as bad as I thought I was. It could take that long, or it takes over time. You know, as you pinpoint what it is, and let's say there were a lot of pain, you know, decrease pain as you go, certain amount of sessions, and then you educate every time. So they might pick it up right away, or little by little they'll get to know how they're moving, etc. Right? So.
And are most of your clients, do they have a physical pain? Like, is it like an injury, a thing? Are they chronic? Are they,
see the spectrum. Right, no. It's a spectrum. Some of these.
Because that's just going through my mind.
Right, no. They email you or they text you, oh my God, I pulled my back out.
Yeah.
You know, and that's why I like the one-on-one. I do 1 hour therapy, one-on-one, because you want to be, everyone has, I have, you know, a guy, you know, I want to be your therapist, you know what I mean, for anything. You know, it's something that, you know, maybe you're going to work on a goal, you know, in your workout, or you're going to run a marathon or something, or, you know, God forbid you get injured, then, you know, you come to me. And we'll solve it. So you see the spectrum of, yes, it could be chronic, acute, or even the preventative, something that you want to, you reach the goal in your workout and you're here. Why? So, you know, that's how I also do assessments of where you're moving, why you're not moving, so that people can, you know, improve their workout goals, etc. So, a wide spectrum of things that we see. So that's why we need to, you know a lot and learn a lot.
So we can get to the preventative, because I almost forgot that, because I'm already in my head, I was thinking of the examples of like how you might see somebody with chronic pain that they've either gotten used to, or they've just been managing mildly, and then there's the whole I pulled my back out, like this just happened right now. And so I'm thinking, oh, there's two different approaches there, and then it's like, no, not only is there, then there's different approach to the thing that hasn't happened yet, which would be the preventive.
Exactly.
But swinging back to this side of the chart with the chronic, is there a different way that you interact with clients that are coming in for something, like they finally are showing up for something chronic?
Right.
Is that different than if somebody had like?
Definitely, I like that. That's why I like the people aspect of it, because you got to make someone comfortable. You know, they've been in chronic pain. You know, you'll teach them maybe why they got to that point. But I think I like to work with my hands, and I think the power of touch is very important. You want them to come in and you know, in the first time you meet me, in like 5 minutes, I'm going to be touching you. You have to trust me, and I have to gain that trust right away. And I try to make people comfortable, and so I think plays a big mental part of it. You know, of calming that down while you're in pain, and that you'll be okay. You know what I mean? And that when we break that barrier, then we could get why you've been in that pain. You know what I mean? So it's very important. I think just the trust. Part of it, and breaking that barrier. You know, I know you're in pain. You're gonna be okay. I think that's very important.
No, especially if somebody's been avoidant, because it's almost like the different layers of avoidance, and you might not even realize that. Like you're avoiding, like mentally focusing on it, and then there becomes like this emotional avoidance too, and then if you're not addressing it. So then with the touch, it almost like reverses that process where the person has to start getting in touch with the emotion, which is also trust.
Yeah, a lot of
and
factors,
then mentally saying like, oh, you know, like I can do certain things to progress that I kind of have been thinking or pushing off the thoughts to
You're not going to break, it's going to be okay.
Yeah.
Right, that's very important.
No, and that's what's fascinating too, because I meet people at the gym that I feel are more physically fit than I am, like not based in comparison, I just see what they do. And then, but then we'll have discussions, and sometimes like they do have an injury, and then I just hear like a lot of the limitations that they're posing, and I'm just like, oh wow, I don't see that physically when you're working out, but when you're talking about it, you have this mental a limitation, and sometimes it like I have my own injuries as well, so I know with certain movements I'm more hesitant or reluctant to do heavy weights or something. Yeah. So I think we all have that. You know, if you're living in the world, you're gonna have so you're using your body, so one part or another is gonna be less functional. So so what's that discussion like? Do you talk about it in terms of like functionality, or do people want to talk about it more in terms of like I said, I think physical prowess of like, I want to be strong, I want to do more, I want to do this, or do you try to bring everybody to that baseline of like functionality?
I think it all comes down to make it basic, step back a little bit, see why they're moving. It's okay to move this way, or the more you think it's a limitation, but it's really not. You know what I mean? So just stepping back and starting from head to toe, see why you're moving, where you're at, where you're weak.
That's and like the basic stuff.
Basic. Even you take a big guy at the gym. I could really show them. They think their shoulder doesn't move because they're so tight. But I could educate them that they actually can go that way. They just never. They haven't taught their body.
We have to talk after.
So
like range of motion.
Everyone has different aspects of. Because I move because of I have a limitation because of so and so. I'm like, no, you're fine. You can move that way. So it's seeing where they're at and how they think they can move or what they know, and then you educate around that. It's all about education and teaching.
But also doing it right. Like, so
and doing
do you give them exercises?
For sure, show them. Once you educate, once you show them their body can go that way, then you teach them to go that way. Your body has to learn. It has a like muscle memory. They talk about muscle memory. You can't go that way. You have to teach it to go that way in a safe and painless way.
Do you display the movements for them, or do you give them like video resources? Like how do you go about?
I think a great way, a great way is like everyone has an iPhone or whatever, or a phone, and a great way is give them basic exercises or stretches, 3 or 4 that you could do. Don't overwhelm someone, and use their own phone to record them.
Oh, okay.
Right, and you can explain through the video.
Okay.
And then they go home and it's like, oh, okay. Like, I know how to do it.
So they can watch themselves.
So they do it, watch themselves do it, right? And then and they might forget anyway, and you always repeat or recap.
Yeah.
When you come back the second, third, or whatever, you say, listen, show me how you were doing, or they come back, you know what, I didn't feel that stretch or whatever, show me how you did it.
Yeah.
There's always modification for everything, So a great way is to videotape them with their own phone, and they can recap. So it's very.
I like that.
Yeah, no, it's great because if I video it, then I forget to email you or whatever. No, it's your own phone.
Yeah.
And do it.
And sometimes it's helpful for them to see, like I know even myself when I do the stretching, like if I remember to do it at the gym, you're not necessarily like watching yourself do it. So I think that, that's also why I like doing the classes that I do. I get to watch other people with the movement. So there's something visually about seeing the form of the movement being done correctly. But then even with the stretching or the alignment and these range of motion exercises that we could do, it is helpful to have that visual or to be in tune with, how am I doing this the way he showed me?
Exactly.
And then getting the feedback whether or not you're feeling an effect from it. And if not, you could either give a different exercise or you could be like fine tune the one that they're doing.
Exactly.
They might not be doing.
As you can always, like this weekend, you can always add to it. You can't subtract, so something basic. And then if it's not working or you don't feel it, you add more,
Yeah.
So I don't want to aggravate anybody going home doing something too intense.
Yeah. Yeah. So you mentioned what's that called again? The tape, the rock.
The rock tape.
Rock tape.
Yeah.
It's
I
called
didn't bring
rock
an
tape.
example.
No, that's fine. So
Yeah.
what's a key thing that you learned about that? Why are so many people using that now?
I really liked. We're talking about like re-education, stuff like that. I like that they explain where you teach someone a new motion, and the rock tape kind of gives you that feedback. They talked about gives you that window of opportunity where you just learn a new motion, and it gives you that little feedback towards that motion, and then you teach them the new motion with either weight or whatever. So I liked it because of that, and also it takes away some pain. You just like explain like decompression of the skin, and they show the science behind how it. So let me ask you. So if you hit your elbow, what do you do naturally? When you hit your elbow,
you rub
it.
Yeah.
So it gives you that little.
Or even an actual thing like this past week, whatever exercise. So right here, when I extend, I feel it. So I've been noticing that I'm like playing with this part of my arm.
Exactly. So the tape can give you a little compression and little override those pain sensors and say and
so now, but is that during when you're only doing the movement, or you wear that at other times too? Like I'm not saying like 24/7.
No. You put it on and see how it works,
okay.
And decrease pain, and then like they said, it gives you that window to say, okay, you're not in pain. We could do the motion now, or
okay. So it's basically just before and during.
Yeah, just another tool. It's not the solution.
Yeah, no.
There's a mental aspect to it. You like it when you wear a brace, you feel safer.
Yeah.
You know what I mean?
Yeah.
So just another tool, and to take it a step further, during treatment, there's other techniques, but it was a very cool course, and they also taught more talking about posture and stuff like that, more assessment of how people are moving, and from every aspect, from people just starting to work out, and we saw people that were heavy lifters. They weren't noticing how they were doing a certain motion that was wrong. So you're always learning, and everyone thinks. Doesn't matter what spectrum. Everyone thinks they're moving correctly, and that's why we're here to, teach you how to move correctly, or how you move.
Yeah.
So not everyone's gonna move the same. Just safe for your body. So yeah. So that's why it's.
So what's one common thing that you find? Obviously, like everybody has back pain or something.
Right.
But yeah, what do most people come to you for?
Well, a major thing is back pain, neck pain. A lot of sitters, we sit a lot in society. So that's a big one, back pain, and the sitting is not so good for you. So
that's crazy, right?
Yeah,
like something so
we're
simple.
not made to. They were talking about the course this weekend. There's some cultures that instead of sitting, they squat. They squat. So back pain is a big one, because of sitting, posture, and neck. So that's where our education comes in, and just not to take away your back pain, but why. So again, with your phones, take a picture of your workstation where you're sitting. There's little tweaks that you could do to maybe help you with back pain as well. It's your environment. I could solve your back pain, but if you're going to go back to that same position, right, we're never going to solve it.
Yeah.
Right.
Yeah.
So that's people not aware of that. Like they come in, it's like, whatever you did to my knee or whatever, the pain came back. What are you doing outside of here? That's aggravating it. Then people don't realize things that they do every day that affect their neck. That they have their monitor on their right side for everything like this, and they're like, I wonder why my neck hurts. So just talking about it, you learn of how what they do every day. So I think it's important in both ways for them to realize and what you learn what they do.
So is that also that's where the preventative discussion can come in as well, right?
Yes. Even if they come in for shoulder pain, you're going to learn that they're sitting say your back is gonna be bothering you.
Yeah.
Or they say, oh, you know what? Yeah, my back is gonna bother me, but they came for shoulder pain. So that's why we spend a lot of time with patients, and you get to learn about their life and what they're doing and whatever, and that's why we're here, to answer a lot of questions and to educate them. So.
Mm-hmm.
Yeah.
So what's one thing that everyone could be doing right now that's gonna ease?
I mean, look at your workstation.
Yeah.
And back pain.
So you're a
take
fan
time.
of like standing desks?
Yes, I mean even standing, you could
That's
you know what I
true,
mean?
yeah.
Just be aware. Put a timer on your phone to take a break. Go do some stretches. I know it's hard in some offices, you can't just lay down and do some stretches, but I mean at least take a break of what you're doing, because you're gonna be there 6, 7, 8, 9, 10 hours sitting. Just to be aware of your environment. Even at in the office, but even at home. Get home, you're gonna stay in one position, hopefully, in a couch, and just be aware of that. Step back. We're talking about stepping back and see what's affecting you. Stay active, for sure. If you're gonna be sitting all day, do something that's active. Stretching, yoga. There's so many great things out there to move.
Mm-hmm.
So to prevent that back pain. Even if see a movement specialist, therapist, whatever, and see what what can be solved, and someone can see how you're sitting. So.
And how frequently do your main clients see you?
Once or twice a week. It depends. Depends if it's post-op. Sometimes 3 times a week. We like to.
So post-op meaning that they
just a surgery.
Yeah.
Exactly. Knee pain, meniscus, ACL. We try to see 3 times a week, and we start weaning off because especially post-op, you're trying to control a lot of the swelling and healing. So it's very important. So you got once or twice a week. Sometimes people come in just for a little maintenance. They've been working out, come in. What's wrong? Tweak them a little bit, go back out there, and come back in. So all aspects. So it all depends on the situation, I guess.
Yeah.
Yep. No, that's it.
Yeah, I haven't really done much physical therapy, to be honest. I know there's always so many modalities, and for me, it's like in being a counselor, a lot of it starts with the cognitive and then emotional, and you can get caught up here, and then it's like, oh, but what are the physical basis for a lot of these things? Right. And especially when people are doing regular movement, or now it's settling in. It's not even movement. Sitting is not even a movement, or they don't associate with it, but it's a posture thing. So it's like, just anything that you're doing repetitively, physically,
exactly,
is gonna have some effect over time. And it's just like it's interesting that I think a lot of us think of more the extreme things, like having an operation or having an injury, but it's the spectrum of things. It's from that to just sitting. Or somebody, it might have been a recent interview, right? The training. It's like sometimes they see a similar thing when someone trains too much or doesn't train enough, and it's all ends of the spectrum. When the person is there, you have to get in touch with them as to where on that spectrum they are.
And then that's the fun part.
Yeah, it is, and especially because it might be one part of their body may be on one end of the spectrum, but another part of the body could be overused. So how do we fit this in the middle?
Well, a great thing, that we were discussing the other day, that your body, we create anatomy. Someone said. So we think of the bicep, but your body doesn't just think of the bicep. For you to move, it moves so many things. Yeah. Just to do this, that so many parts are moving. It doesn't just fire one little thing. So it's all connected. It's not.
I think there's been a movement in a lot of strength training away from the individualized muscle. It's like, oh, I have this machine for that muscle, but that's not how your body is. And that's what I love right now about full body exercises, because you start seeing which part of your body you're kind of like you said, we make our anatomy in a way. It's like, mentally I'm gonna pull, or it's so subtle, but sometimes you pull from an area of your body that you feel is a strength, rather than doing the full range of motion and allowing the parts that might be weaker to catch up to the parts that are stronger.
Yeah, exactly.
So, but sometimes you need that objectivity. You need the physical therapist or the practitioner.
That third eye to say, listen, you're not moving the right way.
Yeah.
And yes, there's exercises to key in on certain things, but yeah, you need someone to look at you as a whole and say,
yeah, exactly.
Yeah,
of course you can hone in on the specific thing, the details, right, and then but then broaden out to the wider picture. Right. And I think that's everything with the health and wellness and holistic health movement and all these approaches. That's what I love about the continued education. It's like you can go get more specific, and then you can bring it, and then you can frame it in the larger scope of how the body is moving, and having the sessions, talking to the clients, getting to know them as individuals, and how you apply all this generalized knowledge to the specific individual.
Yes, I love that part.
Yeah, that's great. Well, that's the social side of you. But so we're already done.
Yeah, that was quick.
This right? Yeah, this was great. And you and I are going to be talking. So I have a couple of injuries. I want to prevent some future injuries. But if you would like to have a session with Fernando, he posts availability on the wellb app. So be sure to check him out there. And thanks for watching. Thank you so much for sharing. This was very informative for me. And we'll learn more about physical therapy moving forward too. So if you have any questions, just let us know. Thanks a lot.
Thank you.